Senate Bill 668 is legislation that I co-sponsored with my colleague, Senator Maria Collette. The legislation created the position of a certified medication aide in Pennsylvania's nursing homes and received unanimous support in committee and the full Senate. When the language moved through the Senate, DOH had no feedback to offer, despite we asked repeatedly. The bill is sitting in the House Health Committee pending action and is delayed because you have concerns. But we haven't been able to get to what those concerns are. We love our ledge liaison, and I know it's not him because he's always very responsive. When could we expect, or is there a timeline on when we could find out about the concerns?
I'd be happy to set up a meeting, and if we reach out to Dan, we'd be happy to set up a time to discuss that. Absolutely.
Perfect. Thank you so much, and we love him. He's great. I wanted to talk a little bit about nursing home staffing support. The governor's budget includes a $10 million allocation to the department to make the long-term care transformation office permanent. Well, I think it's an important venture for the department to be looking at transformational care with long-term care. I'm a bit concerned about the administration's priorities in truly aiding our nursing homes. The Department of Health regulations on nursing home staffing ratios are set to increase July 1. Missing from the governor's budget proposal is a Medicaid rate increase that will fully fund those new staffing ratios. Providers estimate that they're in need of an additional $25.4 million in rate increases to make these ratios attainable. Long-term care facilities need real support and solutions, and providers are concerned that this is all window dressing, and we've had a great deal of concern over not being able to fund these mandates. So help me understand the budget's preference for expanding the Bureau to transform long-term care rather than putting money to direct supportive nursing homes who are already underfunded and unprepared to meet their regulatory obligations. How will the office support nursing homes in the Commonwealth with staffing support?
Thank you. Lovely to see you this morning. You know, long-term care definitely faces many challenges, and we are in the midst of implementing the long-term care regulations, as you talked about. But the long-term care transformation office really is to support all the issues that are happening in long-term care and make them resilient. So, you know, that office started and grew out of COVID and the need to help long-term care respond to infections and to do better in planning. The long-term care transformation office is really working to build resiliency. So they're focusing on staff turnover, staff development, staff recruitment and retention. So they're really working on the core things that are one of the challenges in long-term care, and that's one of them. They're also working on infrastructure and support. Most of that $10 million request is actually to go out to long-term care programs. So for instance, we have given out 126 grants this year to long-term care facilities and in quality investment pilot projects. Those projects' money went directly to the long-term care facilities to support their work, and much of this $10 million is really to go and to continue that quality investment pilot. We're only asking for one staff member in that $10 million. The rest is funded through other means. And so again, it's really to make sure that all of our long-term care programs have time and energy to developing excellence to provide quality care and safe care for all of our residents. So we really see this as complementary to the work of our quality assurance office, but separate really in building resilience. I don't know, Kristen, if you'd like to add anything to that.
But I mean, I still have concern, and as do the providers, with being able to staff up to make those ratios attainable. I just, you know, I don't know how they're going to do that, is my concern. Will you be deploying any staff to help them?
Will the Department of Health be deploying staff?
To help them meet those ratios?
No, but at this point, you know, we have very good compliance with the ratios that have been stepwise. Again, I'm just going to, These long-term care regulations were developed with stakeholder engagement and went through the regulatory process, and they're being implemented, and we're watching to see how they're impacting. But at this point, most facilities are able to meet the requirements. The issues in long-term care are not just the long-term care regulations, it's also workforce development and, as you said, reimbursements, but there's lots of challenges. The Long-Term Care Transformation Office is really working with stakeholders, they're going out into the community and helping to define what are the issues and how can we help. So this office is really, really important to do that work.
Okay, and talking about staffing ratios, how is the department handling good faith efforts made by nursing homes to meet these required staffing ratios? And what about call-offs or a family emergency or weather events? If they have, they're calling it one-off. So, they're great at meeting their obligations to staff. I'm not great, but they're there. But you have these other things that happen, and they get an inspection at that point, and they're just one off their staffing. I mean, tell me about that.
So we are trying to be as flexible as we can, living within the regulations. And I know we've worked very closely with some of the stakeholder groups to really look at that issue. And I'm going to let Kristen give you a little bit more detail on that.
Yeah, thank you, Senator, for the question. So certainly, we have been engaged with our stakeholders and the regulated community throughout our implementation of these regulations. We have made some adjustments to the calculation to account for, as you're saying, call-offs, weather events, things like that, especially for smaller facilities that are running on lower staffing, right? So we have made some adjustments there in terms of how we're calculating that ratio. I think, really the intention of the ratio and the intention of the minimum direct care staffing hours really get to patient care. And so what we see is that, the facilities that meet that have minimum direct care staffing hours or ratios do have better resident outcomes. And so really that's the intent. And, even through the regulatory process, we received a lot of public comments actually from really dedicated direct care staff who are stressed and burnt out from working on really skeleton staffing, right? So really the ratios and the minimum care hours that we came up with were a balance between the reality of recruiting and retaining staff, but also balancing that with making sure that residents are well cared for.
Absolutely, but there's some very good providers out there who will probably get dinged for one-off, just one, and that's troubling too.
Yeah, and I can say that's where our long-term care transformation office can be really helpful. So we're making that connection between our quality assurance deputate that's doing the regulatory role, and for facilities who might be struggling with staffing, we're making that connection to our transformation office so they can go out and offer those staffing supports, workforce development. How can we keep people working in facilities?